They'd brought in this 9-year-old dog, and it had been having vomiting and some blood in the stool. And initially my brain went straight to, just a, hemorrhagic diarrhea syndrome, some fluids, and it will be fine. And they said, oh no, she never received any vaccines, and didn't make it, sadly.
A very warm welcome, Dr. Emma Brown.
Thank you.
Welcome to the podcast. We've done this before, but not in this space.
No, nice new space, very exciting.
Yeah, this is like your timeout space anyway, so you're used to this room. Well, welcome. And thank you for agreeing to another podcast.
Thank you for having me.
Yeah. So the last time we spoke about pain, really, really valuable podcast if the listeners haven't heard it. But this podcast is about parvovirus, and I don't want people to go, it's not relevant. Yeah. It's really, really relevant. And my take-home message is all pets are at risk.
Yeah.
As in dogs. Sorry, let me clarify that. Are at risk of parvovirus.
Yes.
So this time of year, we're seeing quite a few cases. So we can discuss some of these cases, but we definitely have our parvo ward, which is an isolation facility here at Hillcrest Veterinary Hospital. We've got that jam-packed.
Yeah, it was jam-packed this week.
Wow.
Yeah.
Why is that? Firstly, let's start off. What is parvovirus?
So parvovirus is a highly contagious virus that is transmitted between dogs through coming into contact with infected feces, but also indirectly. So if these fecal contaminants come into contact with, your clothing, your hands, toys, bedding, surfaces at kennels, pretty much any sort of surface that has come into contact with these contaminated feces, your pet or your dog is at risk of picking this up, or obviously direct contact with another dog who is infected.
Absolutely. So this is the kind of thing that can be walked into your house.
Yes, it is in the environment. It is alive and well. It lasts in the environment for an incredibly long time. It's resistant to humidity, heat, cold, drying, and even a lot of common household disinfectants. So it's quite a horrible virus.
Absolutely. So in terms of parvovirus, why are we seeing it at this time of year in particular? What is it about it having a seasonality?
So obviously during the colder months, it's a little bit more dormant. Obviously during the hotter months, it generally thrives a little bit better. As with any other bacteria and viruses, normally heat and humidity is key to their proliferation in the environment.
Absolutely. And I suppose this is also the time where we're seeing a lot of younger pets who are more susceptible to it being born and then coming into contact with each other, whether it's either parks or socialization classes or training classes or even
so puppies
households
being more at risk, normally from when they are born, even all the way up to about a year old. But even older dogs that are not vaccinated are also at risk.
Absolutely. And this is preventable.
Yes, 100%.
Yeah. So I feel quite strongly about parvovirus and trying to get information out about it because it's preventable, and if your pet gets it, it is dreadful.
It's awful.
Horrible to have to treat because you see puppies, and I think until you've been in the thick of it and you've treated them, they're miserable.
They're very
painful.
Yeah.
They're so
they can't
unhappy.
Eat. They're not drinking.
It's horrible to watch and horrible to witness something that could have been prevented. And obviously we see a lot of our cases are from welfare situations. So some of the welfare organizations bring these puppies into us and they're doing the best in terms of vaccine. And this is why vaccination is so critical, despite a lot of people being a little bit anti-vaccines these days.
Which is quite sad. We've had a lot of people that aren't aware as to how soon vaccines can be started. Prevention even starts as early as the mother. The mother needs to be properly vaccinated. They then pass their immunity on to the puppies, and that's your sort of first line of defense. Those antibodies or protective sort of mechanisms that are given onto the puppy can last up to 16 weeks. So that gives them a good start to life. So it really does begin early, and then thereafter our vaccines will play a really important role.
So when should the vaccines start? So when should owners or breeders or first-time breeders come in and see us with these puppies?
So first-time breeders obviously need to make sure that their mother is fully vaccinated before they even think of mating. So a good vaccines every year for your 5-in-1s and your rabies. And then your puppies normally come in from about 6 to 8 weeks old and then are vaccinated every 3 to 4 weeks thereafter. However, we do have a new vaccine on the market now, and that is coming in, and puppies are being able to be vaccinated from as young as 4 weeks old. Thereafter, they are still getting their 3 to 4 week boosters. The reason for these boosters is that, as we spoke about our protective mechanism being passed on from our mother, this can last up to 16 weeks. So the purpose of our vaccine is to catch that dip in their mother's protective mechanisms, and hopefully they then start to boost their own, they produce their own antibodies to the parvovirus, and that's when they become protected.
Yeah. And so worthwhile. And there are some breeds that are particularly at risk. Why is this? What actually happens here?
So I think the breeds that are at risk are normally your German Shepherds, Rottweilers. They say black and tan are very susceptible to it. Even things such as English Cocker Spaniels and your Doberman Pinschers as well have been seen to be more susceptible.
And we sometimes advise even another
even up to 16 weeks.
Absolutely.
So even four vaccines, just to make sure that these guys are really given a good fighting chance, because obviously it is such a devastating disease.
And we do see parvovirus in older pets.
Yes, I actually had one the other day. It was a night shift, so it caught me a little bit off guard. It was about 10 o'clock at night, and they'd brought in this 9-year-old dog, and it had been having vomiting and some blood in the stool. And initially my brain went straight to, just a, hemorrhagic diarrhea syndrome, some fluids, and it will be fine. And just as I was leaving the consult room, I said, what's your vaccine status? And they said, oh, no, she never received any vaccines. And I thought, okay, well, let's, first things first is let's do our 3-in-1 parvo test. And she actually came back positive for parvo.
Wow.
As a 9-year-old.
At 9.
Yeah. And we often have these things with many of diseases that the younger and then obviously the older dogs are the ones that are more susceptible to these viruses and that, do struggle a little bit. So she unfortunately didn't do very well and didn't make it, sadly.
So let's talk that, because I think, we talk about parvovirus and the management thereof, but it can be fatal.
Yeah.
And what kind of success rate do we see when we're managing these kind of patients?
So obviously the literature says about 91% of cases die without treatment. Generally, we give our clients sort of a 50-50 prognosis. So 50% they'll make it, 50% they won't. I've seen a lot of papers also say that sometimes if they get to about 3 or 4 days and they generally start to do better. But I think parvo is a day-to-day see how we are managing virus. These guys can get to eating solids. We had one last week. He perked up eating solid food, and the next day he was really down in the dumps, very low temperature, low blood glucose, and also unfortunately didn't make it. So it's a real touch and go right until the end. We cannot predict the outcome from the start, and we just got to do our best and give them the supportive care that they need.
It's very sad. And like we say, dreadful disease to have to manage. So you made mention of some of the symptoms that owners may notice, but let's assume a case example. Someone takes on a puppy, they don't know the vaccination status, and even before they've had the opportunity, the dog isn't well. What are the kind of typical symptoms or things that owners will notice very early on that may indicate that the dog has parvovirus?
So a lot of people assume that parvo is just blood in the stool. So it can even just be that the dog is a little bit lethargic, off their food, not as playful as the day before. Can start with just some vomiting as well, a fever, things like that. And then obviously progresses to the bloody diarrhea, the vomiting, and
total inappetence by that stage, generally.
Yeah.
Sure. Hey there, pet parents. It's Dr. Kara, the Ultrapet vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultrapet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip muscle extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultrapet offers 100% money-back guarantee. Try Ultrapet's premium recipe for short-muzzled dogs today. So we get that phone call, and our receptionists are actually very aware of parvovirus because we see a lot of cases. There are obviously some practices that may not see so many based on where they are, or the population being so well vaccinated, or the number of welfare organizations in that area. But our receptionists are very savvy when it comes to going, oh, this could be. So any vomiting, diarrhea, hemorrhagic diarrhea in particular, they already alerted.
Yes.
One of the issues that you made mention of is how contagious it is. So when they put a note in, this is going to be the consultation, one of the things we generally do is ask them not to come through the door. Is that correct?
Yeah. So generally, if we're doing, on our consults, we'll have our schedule for the day, and it will say unwell puppy. So I'll generally look on there to see if they've come in yet. If they're moaning about vomiting or diarrhea or not eating, normally the first question I'd ask before we've even taken them into the consult room if they have made it that far, because obviously some people are reluctant because, the great fear of, what if it is parvo, and now I don't want to tell you straight away, there is that as well. So then I will say, right, is your puppy vaccinated? Has it been experiencing vomiting and diarrhea? And if yes, then the first step before they go into any of our sort of consult rooms or hospital admissions is a parvo snap test to test for the parvovirus.
Yeah, because this is something that you can't visualize.
No.
And the difficulties are you can visualize the fecal matter on the floor, the hemorrhagic diarrhea or the vomit, but you can't visualize the virus. And so we have very strict hospital protocols in terms of disinfecting, assuming that, we're a hospital.
Yeah.
But we isolate these patients in an isolation ward very specifically, and the kind of measures that are put in place, hopefully you can talk us through it, but in order to manage the spread of this is obviously you want to establish very early on with those kind of symptoms, whether they are...
Yeah, you don't want this going through into your general hospital. It makes, the cleaning and the disinfecting really hard work. So we are really fortunate that we have an isolation facility, which is a completely closed off room with its own vented system, not that it's airborne, but just to help remove the smell and everything like that. There's normally a foot bath with our F10 disinfectant, which is effective against parvo at a specific concentration, which we have it at. And then these guys are kept in their cages, and in terms of protective personal equipment, we wear gowns and gloves, which stay in the ward. And then afterwards, we obviously spray and wash our hands, spray our feet, and use the foot bath on the way out again as well. And all their waste is also separated. They have their own bins, fridges, any sort of bandaging material. If it goes in, it's not coming out.
Food bowls, thermometers.
Yes. Everything is kept in that ward, and it doesn't leave.
Yeah. So we want to be able to get these consultations, if there are parvo positive cases. We want to manage the spread of the virus. What are some of the initial things that you do to support these patients, and how do you manage owners' expectations in terms of it's positive for parvo? What is the next step?
So once we've got a positive for parvo, the next step, which is an unfortunate one, is to discuss funds. because treating parvo is incredibly expensive, just because of all the disinfecting, the amount of supportive care they need, it really is a lot of cleaning and changing and time frame as well. Is we don't know whether these guys are going to be in hospital for 3 days, a week, 2 weeks. There's no actual telling. So once we've got that, we will discuss a sort of an estimate with the owner. Generally, the bigger the dog, the more your estimate is going to be. And then once we've got that, we start to do a preliminary clinical exam. So we are looking at their blood glucose levels, their temperatures, what their hydration status is like. Are they eating yet? Are they vomiting yet? Are they starting with diarrhea? But we've sort of adopted the approach is that if you are testing positive for parvo, you are getting everything on day one. So you are starting on the antibiotics, the fluid therapy, the anti-nausea medication, the prokinetics, so a drug to help with the motility of the gut. We are putting a feeding tube in if these guys are not eating, or if on day 2 they are not eating, they are getting a feeding tube put in so that we can feed them every couple of hours as well. So we're doing everything from the get-go to keep them comfortable.
Yeah. And I mean, many of them, like you made mention of, are really uncomfortable and painful. And so we're all about supportive care, but also just you feel, I mean, if anybody's not been well, a lot of people have been sick with flu and whatnot. When you get better, you only appreciate how important good health is, because they feel terrible. They're nauseous. They don't keep anything in. They're flat. They're often, like you said, hypoglycemic. Yeah. So it's so important to support them with feeding. So let's talk about the feeding tube, because like you're saying, historically there may have been a delay or a reluctance to do the feeding tubes.
Yeah, so initially, obviously your first thought is because they're vomiting, they're not actually keeping anything down. But if we generally have 3 kind of anti-nausea medications that often these guys are on, and that's just how nauseous they are. But if putting a feeding tube in allows us to get the food straight into the stomach, and then once it's in there, then they are able to absorb it a little bit better. So even with the nausea, we're still able to get in. We're not fighting them to force feed them with a syringe, and we're actually able to get a good amount of food in. We also have special formulated diets that are very high calorie content, a large amount of proteins, which is what they need because their gut becomes so damaged. They actually lose all their protein. So they're not actually getting any energy source because they can't absorb it. So the earlier we start, the better. The cells in the gut also need food in order to survive. And because the parvovirus attacks these cells in the gut, we need to get as many of them functioning as possible early on. So early feeding helps. The tube just goes in through the nose and then straight into the esophagus where it sits. And then it is just super glued onto the side of the face for easy access. They do unfortunately have to wear the cone of shame, but it really does help us to feed them.
Yeah. And I mean, there are times where even, we struggle with venous access, and there are times where that tube may even be used to administer some probiotics or medication. So it is another access point for us to be able to best support them. Is that right?
Yeah. So one of the main things that I've found with the cases that, obviously I've worked with is keeping these catheters in, an IV line in one vein is generally only in that vein for 3 days, just because of the reaction that it can cause. And obviously after it's come out of that vein, it takes 2 or 3 days for that vein in that leg to heal. So then we'll move on to another leg. But we also have to remember that because these guys have such electrolyte imbalances, protein imbalances, our veins are actually pretty fragile. So, the more times we're poking them, the more likely they are to blow, in which case we're not able to use them. And they become quite painful as well. We're changing these all the time because they also are passing a lot of vomiting and diarrhea. And as much as the cages are cleaned as much as possible, there is an element that they do sit in them with the bandages. So now the area becomes contaminated, which leads to infection. It is a real struggle to get venous access in these guys. And that is the main thing keeping them alive. So if we can't, then unfortunately, as you say, our feeding tubes are sometimes one of the only ways to keep them hydrated.
Yeah. And like you say, they're immunocompromised. So they're even more susceptible to infection.
Yeah, so the main areas of attack of the parvovirus is your bone marrow. So it's rapidly dividing cells of your bone marrow as well as your gut cells. And if you don't have an immune system, you're not going to be able to fight the virus, let alone an infection from a catheter.
So that explained to the listeners the signs they're seeing, especially the frank blood, meaning the red blood not coming from high up in the digestive system and dark change blood, is indicating the state of the gut.
So basically the parvovirus attacks the lining of the gut. They have little finger-like projections called villi, which are what helps you absorb all your nutrients and your food from your guts. And the virus attacks these, replicates in these, and then goes on to the next one. So in theory, your gut is basically sloughing away, and that mucus and blood that you are seeing in the stool is actually basically your intestines being ripped out. Mm-hmm. And that is why it isn't so incredibly painful for these animals. And it causes such discomfort. The other problem is that with your gut being ulcerated and bleeding, your bacteria in your gut are now given the chance to cross from inside the gut where they were held, and now they can get into the bloodstream. And this is one of the other consequences of it, is that these dogs actually develop sepsis because of this bacteria going through the gut wall.
It's dreadful. It's absolutely awful.
Yeah.
And I mean, at the same time, we see these often the vomiting because the motility of the gut is also impacted. So they, we're trying to rehydrate them, but even the food that goes in is sort of sitting and it's not moving in its normal fashion, and water being resorbed in order to manage formed stool.
Yes.
So the whole system is disrupted, and these pets need a lot of support.
No, they do. So even, they have drips that are spiked with glucose, which helps with any hypoglycemia. I find it's important to even do this even before they become hypoglycemic, because once they become hypoglycemic, it's a struggle to get their blood sugars right again because of that lack of absorbing from the gut. They have, as you said, the prokinetic to help move all the fluid along to try and prevent the vomiting. And we also put electrolytes in, because with the vomiting and the diarrhea, they have huge electrolyte imbalances because it's just been lost in the vomit and the diarrhea. And without your electrolytes, your cells can't function properly. And then, you go into multiple organ failure because your organs can't function.
Mm. So for the benefit of the listeners, we said that it's expensive because of the time frame and all the intensive care. Other than obviously the supportive meds and the treatment and the fluids, what are some of the diagnostic things that we use and utilize in order to assess the sort of success of our treatment or the potential prognosis?
So for initially when they come in, a simple diagnostic tool that we do use quite a lot is a blood smear. So this is just taking a pinprick from the ear and spreading it on a microscope slide. We stain it with special stains and look under the microscope. And here we're looking for the white blood cell population. So as we said earlier, it attacks the bone marrow. So your white blood cells are going to be heavily impacted. If we see that these dogs have really low white blood cell counts on these blood smears, this immediately alerts us to a poorer prognosis. It's not the only thing that we can use. Obviously, cash dependent, we can run a panel of electrolytes to see how much of the spiking of the drip bags we need to do, whether we're just maintaining or if we have to increase the levels of electrolytes. We can also do a blood test to measure a C-reactive protein, which is an inflammatory marker. So it measures the amount of inflammation in the body, and this rises within 24 hours of any inflammation. Again, alone, it's not a prognostic factor. However, higher elevations in the C-reactive protein have shown to be associated with higher chances of mortality. So that is something we can offer as well. And yeah, we look at these, and we're normally repeating these every couple of days if we have the funds to. So keeping an eye on the electrolytes. Another important one is albumin. So that's a protein that is lost from the gut. And if you aren't able to have proteins in your body, you can't keep your fluids in your vascular space. So then you go into a state of hypovolemia, so not having enough blood volume to pump around your body, which then leads to shock as well. So those are all diagnostic things that we can do, keeping an eye on electrolytes, the C-reactive proteins, keeping an eye on our blood smears as well, things like that.
Yeah. And I mean, you spoke about some of the secondary things in your explanation, like the sepsis. We also see things like intussusceptions. Can you explain what that is and how we assess for the changes in the gut?
So for changes in the gut, we can do ultrasounds as well, which give us an indication of motility of the gut. So generally on the ultrasound, you can see them contracting and opening and contracting and opening. Normally when these guys have stasis, they will sort of just stay as round figures on the screen, and they'll also be full of black fluid. Intussusception is basically telescoping of the intestine. So this generally happens when you have areas of motility and stasis and a very inflamed gut, and they sort of telescope into one another. Once this happens, the intestine starts to adhere to each other, and it's very difficult to part that. The vomiting will obviously get worse. The dog will be in a lot of pain, and we also sometimes see this intussusception with high worm burdens, which, funnily enough, parvo patients are also screened for regularly, because if unvaccinated, we also assume not wormed or insufficient worming as well, and they generally also have high worm burdens as well. So we want to try and remove that so they don't have the added stress of worms and a virus.
Of course, trying to fight two things at the same time is not ideal.
No.
So let's talk about how you manage expectations with owners. So you say from a financial perspective, how generally owners, from my experience, are always quite horrified at the prognosis. Yeah,
so I found this quite alarming, that most people don't realize how terrible the disease is. We're either going to treat or, unfortunately, we're going to euthanize. I've had a lot of people ask, well, can we not just, take the dog home and see how it gets on? There is the option of doing outpatient treatment, but not a lot of these are successful at all. As we said, a 91% mortality rate for untreated cases. So people are very, very surprised when we have to give them the option of either treating or euthanizing if there's not a lot of funds, or if we feel that the dog is in such a state that pursuing treatment is not really going to change the outcome. So in terms of managing this, obviously I go from the point of saying that because of the horrendous disease, I go through the symptoms they're going to go through over the next couple of days, and how horrid they're going to feel, and just sort of give the owners an idea of, how serious this is, to make them, sort of come to terms with how devastating the virus is.
And we often don't take the opportunity to talk costs, but, inpatient type care, what are we looking at in terms of the costs associated currently within our practice, just for transparency, the kind of cost for some of these patients?
So we are starting our quotes at about $15 1,000 Rand for smaller dogs. And then obviously this can go up to about 25,000 Rand. So I'm quite open with my quote. I'm going to say we need to do everything if we are going to give it a good go. So you are looking at 15 to 25,000 Rand. A lot of places will also expect a deposit because of the amount of consumables. We generally ask for a 50% deposit, and then the rest is to be paid on discharge. And we keep a daily communication with the owners as well as with what we're sitting at, and this will also determine how much of the diagnostic tests we get to do as well. So
yeah, and
it's pricey.
But also in terms of that, the reality is that you could have a bill of 20,000 Rand.
And you might not have a dog at the end.
And I think this is the hardest thing for people, when it's a positive outcome.
Yeah. This for me is really difficult to manage, not only from an owner's point of view, but also personally, actually, because, I've, got your dog in to treat and I've tried my best, and you've spent all this money, and unfortunately I still haven't been able to give you a guarantee that your dog is going to survive. As we said earlier, I generally go on a day-to-day basis, and I say, today was a great day. We had some eating, we had less diarrhea, or today was a really hard day. There was a lot of diarrhea, a lot of vomiting. We're not in a good space. We have a low temperature, and just trying to run through the motions with the owners as well.
So that better communication is actually important for them to be able to manage expectations.
I feel like even, getting them to just outside the isolation ward so they can actually see what's going on, as hard as it is. Just to understand what the pet is experiencing, and just so that they get an idea of what we're doing every day. Have a good chat with them about how they're eating, drinking. Are they wagging their tail? Did they lift their head up today? Are they crying in pain? We often have the saying of, it's doing the parvo cry. And, sometimes these little dogs just get to the end and they're just so painful and just start howling. And for me, that is the most...
It's awful.
It's the hardest thing to see.
I don't want to miss the opportunity to ask you about outpatient care. Can you explain, firstly, what that is, the success of it, and why owners really struggle?
So outpatient care would involve the owners giving medication at home. So that would be in terms of antibiotics, pain relief. These are all oral things, which obviously when they're vomiting, it's quite difficult to keep down. The other thing that we teach them to do as well is to administer fluids under the skin with a needle. Obviously, as you can imagine, no one really wants to go poking their pet 3 times a day with a needle. These dogs are also painful. So, trying to restrain an animal that's sore to give them the fluids, and trying to keep the oral medication down is also quite a struggle. And I think just the amount of vomiting and diarrhea and nausea that you're not going to replace what the dog is losing, and oftentimes these are not very successful at all. They need to have the IV access to deliver the fluids while they can't eat, and have the tubes in to feed. Obviously, we could place a feeding tube for them to manage at home. The only risk with obviously these feeding tubes is that because the dogs are vomiting enough, they do this sneaky little trick where they come out of the esophagus and back up into the mouth. And, you could be without knowing, passing food into the windpipe now, which then, gives an even worse prognosis because they develop pneumonia. So, these things are really needed to be handled in a veterinary facility. The owners also aren't able to monitor as much as we are. So they can take a temperature, but unless they're doing like blood glucoses every couple of hours, or, checking their electrolytes to see if their bags need spiking. I can't really fathom how you would do that at home, considering how much I know we do here. So
I agree.
Yeah.
So take home message, obviously, I think we've hopefully got the point across that this is something it's not easy to manage. It's very expensive. it takes time and there's no guaranteed outcome.
Yeah.
And it's not really advisable to do it at home practically and probably from a welfare perspective because it's hard to support them.
Yeah.
Vaccination, it's preventable.
It is.
And it's about having a population of pets that are vaccinated in order to sort of then manage it. So, with people going, oh, but my dogs don't go out, it's something that can be brought into the household. And
yeah, so I mean, if you think about it, even if you have sick elderly parents at home that never go out, they still get sick because you go out, you get sick and you pass it on. It's the same type of thing. You can still transport those infective little agents back into your household. So vaccination is super important. If you're buying a puppy, make sure you get the information from the breeder. If the mother is vaccinated, when was she vaccinated? How is her vaccine history?
And with what? Because sometimes
it's with what? Yeah. So you'd be surprised as to how people are like, yes, my dog was vaccinated, and the unfortunate thing is that some people try and do it on the cheap and they get a half vial here and a little bit there, or they've had one vaccine and they're like, yes, my dog is vaccinated. No, they need 3 or 4 vaccines as a puppy, 3 to 4 weeks apart. And, even then you're only taking your puppy out after the 3rd vaccine. It's not one vaccine and then off to the park. You need to be careful as to where you expose them before their full vaccine course is done. So vaccination is important. If you aren't able to monitor them going out, for instance, if you've gone up to Joburg or Cape Town to pick up a puppy, plan your stops on your way home. Obviously, they've got to go to the loo. Choose places that aren't so busy. Make sure the breeder has done some vaccinations, or ask which vaccination has been done. The Puppy DP Plus vaccine actually provides them with immunity 3 days after the vaccine. So, if this is a big concern and you're having to make these road trips, ask the breeder to go and get the puppy vaccinated with the DP Plus. Then, you can wait a couple of days and then transport the puppy. And it just reduces the risk and, the devastation.
And then finally, because I can't miss this critical take-home message, if you have had a positive parvo case, so your pet has suffered with parvovirus, when can you get another puppy?
I would say only after about a year. So parvovirus can last about 8 months in the environment. And unless you are bringing a fully vaccinated dog into your home, we would only encourage getting a new puppy about a year later. They also say that, the parvovirus can be shed 40 days from after they've been infected. So, it's also about making sure that when you've taken them home from the hospital, you're not running them around in public. And we do caution owners with that as well, saying, it would be best, for them not to go to public spaces for at least 2 months and new puppies within a year.
Absolutely. And then one of the other things that I find commonly is when I ask owners, are they vaccinated? A lot of these owners have been through our rabies drive. And so they associate vaccination, or they give me the information that their animals are vaccinated. When were they last vaccinated? And we've obviously become a lot better at asking very specific questions, like when were they last vaccinated against? Because we do not, in those free rabies drives, do the full course. And we have to remind owners that, yes, although there's a legal obligation to vaccinate against rabies, they really ought to be doing the others.
Yeah, so your core vaccines, which are vaccines that your puppy should receive, is the 5-in-1. There are many brands of them, but basically it covers the canine parvovirus, your para-influenza virus, which is like a flu, also a component of the kennel cough, your canine infectious hepatitis, which is also very deadly, your canine distemper virus, which also really devastating
and
disease
we see
as well, and we do see it. And then so that would be your core vaccines, and then your rabies as well. So when you are booking your appointment for your puppy, spend some time chatting with the vet about what your vaccine is covering. Make sure you are getting your core 5-in-1 vaccine as well as your rabies. And these again need to be done every single year after your primary puppy vac.
Particularly in high-risk areas.
Yes.
It's different if you're in a population. Some vets may be advising in particular areas, okay, it can be every 3 years after the initial, year booster.
Yes.
But we certainly can't be advising.
Also depends on the licensing of your vaccine. So some vaccines are licensed for every year administration, and others do have every 3 years. But we generally err on the side of caution because of the prevalence of it in the area, and would go with every year.
Absolutely. So let's discuss, because we know that management of this disease is difficult. There is hope in terms of assisting us. What are some of the advancements in the management of this disease?
So I've had a couple of owners come to me asking about a new drug that has just been, well, not just, but in 2023 was approved by the FDA in America, and it's a monoclonal antibody therapy. So basically what it is an injection that is given IV, and this goes and binds to the parvoviral proteins and prevents them from entering cells and replicating. They have had really good success from what I've read. Obviously, it is by no means a answer to not vaccinating your pet, because I can guarantee it's going to be a very expensive therapy, and I imagine they still need supportive care of hospitalization. I don't think it's going to eliminate the need for that, but they say that it reduces the symptoms and the severity of the disease. So that would be something to really look forward to, because it is a devastating few days to weeks that you have to watch these dogs suffer through this as well.
So not yet available in South Africa, but
not yet available, but hopefully on the way.
Yes, very much so. Thank you. So very appreciative of your explanation, and thank you for taking us through the disease process and what owners can do to manage it. And thank you very much for caring for the ones. I know that you've been very active in, especially with the night shift work. It's very labor intensive, and it can be quite emotionally take quite a toll on us, as veterinarians.
These poor little puppies are so ill, and they just feel so horrible. My heart breaks for them having to treat them. It really does.
Thank you for all the work that you do.
Thank you.
Dr. Emma Brown. Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today, and we'll deliver pronto.
Wow! I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.